Hello, my name is Katelyn Garcia, and along with Rachelle Jillson, Cara Jacob, and Calvo, we will be discussing the debate on embryonic stem cell research. Some people believe stem cell research should be accepted because it saves human lives. Others think stem cell research is immoral and unethical because it ends a potential human life and diminishes human dignity. The Catholic Church believes that embryonic stem cell research is morally wrong because in the process of obtaining the necessary embryos, the potential for human life is destroyed. While others argue that embryonic stem cell research can save more lives than would be harmed in the end, as well as improve a mass amount of people's quality of life.
Hi, my name is Katelyn, and I'm going to be talking to you about what stem cell research is and the different methods and procedures used to obtain stem cells. Different types of stem cell research offers more benefits than others while reducing the risk associated with stem cell transplants. Stem cell research is experimenting with human stem cells in order to find treatments for human medical conditions and diseases by replacing cells that have been lost through disease or injury. Stem cell therapies involve the integration of replacement cells into the existing tissues of the patient. Stem cell research uses either adult stem cells or embryonic stem cells. The most promising research is occurring with adult stem cells. Currently, no useful embryonic stem cell-based therapies are being used or are being helpful. Now onto the methods and procedures. Stem cell transplantation procedures have been performed in clinical trials throughout the past few years. With these new procedures, there have been side effects which must be taken into consideration when evaluating the benefits of stem cell research and what kind of stem cell research offers the most gain. Hematopoietic stem cell transplantation takes stem cells from bone marrow and transplants them into another patient. Now, a study found that there was a correlation between hematopoietic stem cell transplants and infected patients. Bone marrow transplants require a very long period of immune suppression, which is most likely the cause of the increased chance of becoming infected with a disease. Embryonic stem cells are derived from human embryos, usually embryos specifically created for lethal experimentation. Embryonic stem cells are created from blastocysts. Blastocysts is usually donated to research from in vitro fertilization clinics, contain about 100 stem cells, and are about 1 week old. In order to get embryonic stem cell lines, the blastocyst is destroyed. By adding different growth factors, it is possible for these embryonic stem cells to develop into different cell types. Umbilical cord blood is used in stem cell research due to its rich, multipotent hematopoietic stem cells. These stem cells found in cord blood can be used to treat the same disorders as the hematopoietic stem cells found in bone marrow and in the bloodstream, but without the same advantages of these types of transplants. Cord blood is currently being used to treat approximately 70 diseases such as leukemia and lymphoma. Now on to the next segment.
Continuing our discussion on stem cell research, we believe that stem cell research should be accepted as it saves human lives every single day. It also helps science thrive because it gives science opportunities to do research and bring out certain things that it wouldn't be able to if stem cell research was disapproved. It also brings out many cures to people. Some of the cures include Parkinson's disease, spinal cord research, injuries, diabetes, heart disease, Alzheimer's, ALS, lung disease, arthritis, and many incurable diseases that are now curable because of stem cell research. There are two processes that include stem cell research, and those two processes include adult stem cell research and embryonic stem cell research. And that is the process in which the embryo has the stem cells in it, and the stem cells are taken out of the embryo. The stem cells are taken out of the embryo and put into the other person. This is not harmful to anybody because it is after conception and it is not a human life that is being disturbed. This process has worked for centuries, but many people disapprove. But there are more people who fight for it, and many people who fight for it have to fight for their rights because it saves so many lives. Some people would rather save thousands and millions of lives rather than some people who believe that one life is put in harm. Future research could save lives. This is why this should be brought out for even longer. People who bring out stem cell research are considered scientists, specifically medical scientists and genetic scientists. Patients with this get cures that they yearn for. They wait years and years just to get these cures, and now they have them because of stem cell research. They thank them and the scientists.
There have been recent arguments in the opposition of stem cell research, and in the views of the Catholic Church, stem cell research should be prohibited because it is seen to be an immoral and unethical end to potential human life. Stem cell research has been believed to destroy the human life of an innocent embryo. Now, some people see that ending the life of an embryo is equivalent to ending the life of a fully formed human being. Recent studies show that stem cell research is true and complete destruction of an embryo, which is known to be soon fully formed human, which is 100% against the views of the Catholic Church. Now, the Center of Bioethics and Human Dignity, which is an evangelical Christian organization, recently stated that embryos are the tiniest of human beings and are not mere biological tissues or clusters of cells. Now, in the Church's view, only God Himself has the ability to destroy human life, so it is a grave and terrible sin for those who do it themselves. Not only does stem cell research end the life of a potential human being, but it also limits and takes away the rights of the future child. Now, in the views of the Church, a human's life begins at the time of conception, which means that each embryo has endowed their basic rights like any human person. Now, by performing stem cell research, it completely destroys the embryo, which is argued to be a full person, also destroying and taking away the rights of the embryo. It is known for each human person to have subject to their own rights. The person's dignity and right to life must be respected from the first moment of their existence, which is seen to be taken away by the process of stem cell research. Now, each living person has their own rights and their own decisions, and those should not be decided or taken away by or from any other human being. Now, I don't know about you, but I sure wouldn't want to end the life of my child.
Hello. Today I will be talking about both the support for embryonic stem cell research and the opposing views. Embryonic stem cell research is a very complicated issue since it has to do with the topic of morality. A lot of people don't believe it is in no way, shape, or form moral because there's no way of knowing whether or not this study will work. So many potential lives are lost when obtaining the embryos. So a lot of people believe that it's for nothing. There have already been countless attempts and failures, which continues to discourage people from believing in this cause. Albert Mohler calls embryonic stem cell research a direct attack on human dignity. It takes away the rights of those who can't yet fight for themselves. Many people who have suffered the loss of a loved one, whether it be losing them mentally or physically from a disease that could have been cured with these studies, usually support embryonic stem cell research. Research has come out that the new way of obtaining the embryos is through the leftover eggs from IVF that would have gone to waste either way. Embryonic stem cell research has been called the future of medicine. It gives the potential to save lives because it is able to be molded into whatever somatic cell is needed to save or elongate a life. They believe that a better quality life is worth more than someone who will be bedridden for most of their life or dependent on others, which eventually causes harm to the caregivers and takes away their life.